The American Diabetes Association recommends the use of aspirin as a primary prevention strategy in patients with diabetes who are at increased cardiovascular risk, including those who are older than 40 years or who have additional risk factors such as family history, hypertension, or smoking. Now in JAMA, researchers for Japan report on the JPAD study, which was reported at the American Heart Association. The JPAD study examined whether low-dose aspirin would be beneficial for primary prevention of atherosclerosis. From December 2002 through April 2008, patients with type 2 diabetes and no history of atherosclerotic disease from 163 institutions in Japan were enrolled. Patients were randomly assigned to low-dose aspirin, receiving 81 or 100 milligrams per day, or the non-aspirin group. Average age was 65, and 55% of the patients were men. Median follow-up of the study was 4.37 years. The main outcome measures were atherosclerotic events, including fatal or non-fatal ischemic heart disease, fatal or non-fatal stroke, and peripheral arterial disease, a whole panoply of atherosclerotic outcomes. In patients aged 65 years or older, the incidence of atherosclerotic events was significantly lower in the aspirin group than in the non-aspirin group. However, in patients younger than 65, there was no difference in events. Aspirin was well tolerated without a significant difference between aspirin takers and non-takers for bleeding outcomes. So what does this JPAD study really mean for your patient care strategy? While this study did not find that low-dose aspirin reduced the risk of atherosclerotic events in primary prevention therapy in all patients with type 2 diabetes, remember that there is a low incidence of atherosclerotic disease in Japan, which may have changed the outcome. In addition, the secondary endpoints of cardiovascular death and a subgroup analysis does show that in patients more than 65 years of age, aspirin is effective. Probably a good idea to continue aspirin in your elderly diabetic patients. I'm Peter Block, and this is CVN.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.